Well, we're predominantly an anterior segment practice, so I do approximately 50 to 75 SLTs a month, probably on order of 100 to 200 capsulotomies a month. Iridectomies are a little bit less common, probably about 5 to 10. We do no retina procedures. I would say as far as SLT procedures performed for primary purposes, approximately 40%, and that's actually a growing number for us. Repeat, relatively infrequent, maybe 10 to 15% are repeats. We do quite a lot of replacement therapy or adjunctive therapy, and that would probably represent the remainder of the percentage. This is probably the safest procedure that I do in ophthalmology. Of everything that I perform, this has the lowest side effect profile and the greatest risk to benefit ratio of anything that I perform. It really is a fantastic machine that I can't say enough about. When I came out of training, I was of the mindset, medicine's first, lasers, surgery second. What I discovered just throughout the next several years of practice, that medicines were not necessarily the panacea that they should be. There's a lot of compliance issues, there's a lot of patient expense issues where they just don't have the money for necessary drop use. And compliance is a much larger issue than really gets the necessary press that it should. What I started doing SLT was mainly for adjunctive therapy, and I was getting such phenomenal results with it that I began to use it more in a primary therapy role. And as I did that, I discovered I was getting much tighter control of IOP, much better compliance, obviously, because this was non-patient compliant related, and certainly the response was there. So I had much tighter pressure controls and much better glaucoma control. Predominantly, the most encompassing feature of the SLT, what I find the most incredible aspect of the SLT, is its safety profile. It is phenomenally safe. I've performed well over 1,500 SLTs and can count on one hand the amount of serious complications, if you want to call them serious, that I've actually had. Most of those complications are short-term with complete resolution with follow-up management. So in regards to what attracts me most to the SLT, it's the safety factor, and then of course the effect that we get from the machine. It's very quick. It's done in the office, so it's very easy to have patients done on the fly. So I can react to a patient that's interested in SLT at that moment and get them down the hallway to have the procedure performed with very little impact to their schedule. The other aspect is there's very little in the way of necessary follow-up. Patient really just has to come back to see us once or twice to make sure that we've gained a nice effect. And the patient is pleased because there's no post-operative medications or drops that they have to use. So it's really just kind of ease of use and the simplicity of the system. Lumenis has always been very receptive to any kind of phone call, questions, comments, etc. They're also very engaged as far as marketing materials. The Lumenis rep has always been very generous with different marketing pamphlets and such that can be handed out to patients that can kind of drive patient interest in the procedure. The biggest obstacle to SLT purchase is the price. It's an expensive machine, and it's a lot of money up front, and especially for a smaller practice, it's a lot of money to consider investing in a piece of equipment. And there really isn't a way around that. It is expensive, but in my personal opinion, I think that it's worth it. And I think that it's, with proper application of it in the office, I think it's a number that can be overcome pretty quickly. Buying the SLT, there's a large advantage that one can take advantage of. In a rental or roll-off situation, you have to batch your patients. You have to bring them in. in larger numbers. You have to put patients who just missed the roll-off appointment, off for the next month and a half until you have the machine again. Patients typically don't like to do that. Patients don't respond very well to appointments 3 weeks in advance especially for replacement therapy type issues. When you own the laser, you can do it on the fly. You have it with you. It's down the end of the hallway. You tell her, Mrs. Jones, I have this great new therapy for you. They can do it that afternoon. Boom, they get it done, and everybody's happy. I've found pretty much an order of magnitude improvement in case number by simply taking the laser out of the batching environment, out of the ASC type environment or the roll-off environment, and having it physically present in the office with me when I see patients. It's an investment up front, certainly, but ophthalmic equipment is expensive, and there's no way around that. But it's a machine that has a lot of positive benefits, not only for your patient, but also for the doc, as far as it's kind of eliminating some of the normal hassles associated with medical management of glaucoma. I would strongly recommend SLT. I'm a fervent fan of SLT. In my opinion, it is the way to treat glaucoma. It is incredibly safe. It's very easy for the patient to go through. It works, and it works well, especially in a primary therapy role. I've seen significant drops in IOP that have been maintained for several years, and that's a huge savings for the patient as far as expense that they've had to invest in drops month to month. I get tighter IOP control that's stable. We don't have the missed drops and I ran out of my refills, etc., where patients come off medication. So the glaucoma is better control. Just kind of off the cuff, comparing my patients on medicine, my patients who have been treated with SLT, and my SLT patients convert to progressive glaucoma at a far lesser rate than my patients who are on medical therapy. I tell them it's worth it. It's an expensive machine, certainly, but like I said, by having the machine with you in office, your case numbers will increase, and I think that you'd see enough numbers coming through that you would offset that initial expenditure, and probably within a short period of time be able to get out from underneath the expense of the machine.